Today, we're talking about temazepam, a medication used to treat insomnia. It can help you fall asleep faster, stay asleep longer, and reduce how often you wake up during the night, so you can get a better night's rest. Temazepam belongs to a class of drugs called benzodiazepines, and it works by producing a calming effect on your brain. It's important to note that the use of this medication is usually limited to short treatment periods of 1 to 2 weeks or less. If your insomnia continues for a longer time, it's best to talk to your doctor to see if you need other treatment. Before you start taking temazepam, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually just before you get into bed. The dosage is based on your medical condition, age, and response to treatment. To reduce the risk of temporary short-term memory loss, make sure you have at least 7 to 8 hours for a full night's sleep after taking this medication. If you have to wake up before that, you may experience memory loss. If you find that the medication is not working as well as it used to, talk to your doctor about it. Although temazepam helps many people, there is a risk of addiction, especially if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. If your condition lasts after 7 to 10 days, or if it gets worse, make sure to tell your doctor. After stopping the medication, you may experience trouble sleeping for the first few nights. This is normal and is called rebound insomnia. If this effect continues, contact your doctor. If you experience dizziness or difficulty with coordination while taking temazepam, be sure to tell your doctor or pharmacist. To reduce the risk of dizziness or falling, make sure to get up slowly when rising from a sitting or lying position. It's important to note that temazepam may make you feel sleepy during the day. If you experience daytime drowsiness, be sure to inform your doctor as your dose may need to be adjusted. Remember, the benefits of taking this medication have been judged to outweigh the potential risks of side effects. However, be sure to tell your doctor right away if you experience any serious side effects such as memory loss, changes in mood or behavior, or if you engage in activities while not fully awake, such as sleep driving, sleepwalking, or preparing food. While serious allergic reactions to temazepam are rare, it's important to seek medical help immediately if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to keep in mind that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Also, remember to consult with your doctor before making any changes to your dosage or timing of taking temazepam. Temazepam is a medication that should be taken with caution as it has a risk for abuse and addiction, which can lead to overdose and death. It's important to take the smallest effective dose for the shortest possible time to lower the risk. It's also crucial to avoid alcohol and other drugs that can cause drowsiness or breathing problems, such as opioid medications like codeine and hydrocodone. It's important to know how to take temazepam and what other drugs to avoid while taking it. If you experience serious side effects like slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up, seek medical help immediately. If you've been taking temazepam for a long time or in high doses, suddenly stopping the medication can cause serious withdrawal symptoms. To prevent this, your doctor may lower your dose slowly. Let your doctor or pharmacist know right away if you experience withdrawal symptoms such as headaches, restlessness, hallucinations/confusion, depression, nausea, or seizures. Withdrawal symptoms may last for weeks to months. It's important to follow your doctor's instructions carefully and take temazepam at the recommended dosage and at the optimal time for best results. Before taking temazepam, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes any kidney or liver disease, breathing problems, mental health issues, and any history of substance abuse or sleepwalking. Since temazepam can cause drowsiness, it's important to avoid driving or operating machinery until you know how the medication affects you. It's also best to avoid alcohol and marijuana while taking temazepam. If you are planning to have surgery, it's important to let your doctor and dentist know about all the medications and supplements you are taking. For older adults, temazepam may cause increased dizziness, confusion, and drowsiness, which can increase the risk of falling. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of temazepam with your doctor. This medication can harm an unborn baby, and newborns of mothers who use this medication late in pregnancy may experience symptoms such as slow breathing, excessive crying, shaking, or trouble feeding. Temazepam can also pass into breast milk, so it's important to consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions with temazepam, as they can affect how the medication works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with temazepam is sodium oxybate. Taking temazepam with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines, can increase the risk of serious side effects. It's important to inform your doctor or pharmacist if you are taking any of these products. Additionally, it's crucial to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using these products safely. If someone has taken too much temazepam and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of temazepam overdose may include slowed breathing or falling into a deep sleep from which you cannot be awakened. Temazepam should not be shared with others as it is against the law. It is important to consult your doctor or pharmacist if you experience changes in your sleep pattern as you age. They can provide you with non-medication methods to improve your sleep, such as avoiding caffeine and alcohol close to bedtime, avoiding daytime naps, and establishing a consistent bedtime routine. If you happen to miss a dose, it's important not to take it unless you have enough time to sleep for 7 to 8 hours afterwards. This will ensure the medication can work effectively and safely. When it comes to storing temazepam, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always make sure to keep it out of reach of children and pets. If you have any unused or expired temazepam, make sure to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.